And let me say good afternoon, and again, let me thank the media for covering this press conference again. Let me give you the count for today. Houston Health Department is reporting 71 new cases of COVID-19, bringing the total case count in the city of Houston to 3,046, so 71 new cases. I am pleased to report that there are no additional deaths being reported today, and that's so our death count. I don't necessarily like that phraseology, but the death count remains at 34. That means this is the fourth consecutive day that we are not reporting anyone passing as a result of COVID-19, and that's good. That's good news. Today's focus is going to be how we address our vulnerable at-risk populations to make sure that we don't leave anyone behind and that we're meeting all of their needs. As you know, as I indicated, Marvin Odom, and Marvin is back there, is leading this effort. This is a task force that's going to be working very closely with him. But before we get into the nuts and bolts of that task force, a topic that we have not specifically addressed, and that's for people who are riding our buses and light rail, transit, and making sure that the bus drivers and the operators are safe, as well as the people who are riding on our transit system, that they are safe. And there's no better person to talk to you today about that than the chairman of Metro Board, and that's Carrin Patman. Carrin, welcome. And today is going to be very special on many fronts, in addition to the substance, but over the last 8 weeks, you've primarily heard from guys. We've been the central, we've been with, every now and then, there's been a woman who appeared, but today, this is all about her. This is all about her, not about him. Today, this is about her. And so, to start off these presentations, there's no one who has a higher profile, and certainly has just been instrumental in moving our whole region forward than Carrin Patman. So proud to have her as the chair of Metro. Carrin.
Thank you all so very much. And if you're looking at this clumsy mask, I made it. And you too can make one with the pattern that is now on the Metro website, now that we're all going to be masking up, and I know the mayor's going to talk more about that in a minute. I wanted to just give you a status report on everything we've been doing. I'm really proud of Chief Lambert and Jerome Gray and Tom Jason and others who have led these efforts. And because we really have, I think, been on top of it from the outset. Of course, our ridership is significantly down, as you would expect it to be in this situation, because we are discouraging discretionary rides, as everyone is. But nonetheless, it's important to note that we still are giving 100,000, more than that, rides a day, which shows you how critical these services are, without which folks could not move. It's probably right now a little safer to drive in a car if you have one, or if you can afford the parking, or if in fact you can get there in light of the crippling congestion that would result if everybody did that. But we nonetheless are giving over 100,000 rides, and we give 1,000 to 2,000 rides on our service for the disabled, Metro Lift, every day. So just so you know, the smallest decline in our ridership is on the local bus. The largest decline is on the park and rides. And so we have cut park and ride service except to the medical center, which of course a number of people that commute go to the medical center, and they're more needed now than ever. We've been doing a number of things to keep our riders safe. One is that for weeks now, we have been social distancing on the buses. We have barriers so that riders now board from the back, and so that they don't come in contact with the driver unless they're disabled, in which case the driver does step out and assist them on. But they board from the back. They can only come up to a certain point to avoid exposure to the driver. And we socially enforce social distancing on the buses with signs, and then once one bus is full, because it's the social distancing means that fewer people can occupy it, we have another bus at the ready to take those folks. We're about to embark on a mask program. Our drivers have been wearing masks now for a while. But it's time, I think, too, for the public who rides us to be wearing masks. And so we're going to encourage that. Again, you can make your own mask based on the pattern that's on the web. You can either sew it, or there's even a pattern for how to do it without sewing. And furthermore, we're going to have masks. As soon as we can get an adequate supply in, we're going to have masks for folks that come on the bus and don't have one. Because it's not fair, obviously, to force people to ride masks unless, if they don't have one, you can provide one. So we're going to try to do that. But we do encourage everybody that can to obtain one from any source you have, or make it. It's really easy. If I could do it, anybody could do it, believe me. So we've reduced seating about 50% on the buses. We've added buses to the TMC and other heavily traveled routes. I think I've covered, oh, that's right. We've put signs conveying safety information across the metro system. We've increased the daily disinfecting of metro facilities and added midday cleaning to vehicles with an emphasis on frequently touched surfaces, like the poles on the rail line, for example, that you grab onto as you're riding. Those get extra disinfecting. And we've temporarily suspended fares for two different reasons. One is we're a community partner. This is a really tough time for everybody, and therefore we want to do what we can to alleviate the financial suffering. Second, though, it also makes it much easier for people to board from the back and to socially distance when you don't have to go up to a fare box in a bus, or you don't have to touch a fare machine at the rail. It makes it much easier to socially distance. And now recently we've began implementing temperature checks for employees that are coming to work as an additional safety tip. We communicate service and other changes through news releases, social media, service alerts, and a special coronavirus landing page at ridemetro.org. Thank you again, Jerome, for all you all have done on that. And of course, we continue to work very, very closely with other public health officials and with everybody, frankly, as part of the SWAT team, the mayor's team, other teams, other transit agencies all over the country. And in fact, I'm proud to say that a number of other transit agencies have viewed us as on the vanguard of what should be done in this situation and have been consulting with us and adopting things that we've done. So that's a synopsis. You can go on metronext.org. You can see the COVID page, and that will tell you even more things that we're doing. It's really been a huge effort to be sure that we do what we can to educate the public and keep the public as safe as we can. So thank you so very much. That's mine, I think. Oh, no, this is yours, ma'am.
Let me thank Carrin, and we're going to do everything that we can to assist in making sure that anybody who needs a mask will be able to get a mask or a face covering when they're riding Metro. It is a mask over citation. We don't give citations. We give masks or face coverings. And so the police, Metro Police, if we run into someone who doesn't have a face coverings, instead of giving them a ticket or a citation, we give them a mask. And because we want the people to be healthy. Now, Houston needs to wear a mask in public starting on Monday to comply with the new Harris County order. And I see Dr. Kathy Flanagan over there, who is helping us out. So, Dr. Kathy Flanagan, thank you for being here. And to comply with the new Harris County order, so you can find if you don't have a mask. But if you can't have be but you can't have a mandate without making resources available for people to follow the rules. And I want to give masks and nice citations. So today, we are launching the Mask Up campaign to encourage all Houstonians to wear masks in public. And I've asked some of our most favorite recognized Houstonians to be campaign ambassadors to help me and others in the task force to get out the message. And I want to give a special credit to the task force because they have helped to get these ambassadors to agree to be a part of this program. Today we have with us via a live feed Olympic gold medalist and world champion gymnast Simone Biles, Major League Baseball World Series champion Carlos Correa, and Houston rapper, the boss of all bosses, Slim Thug. He and I have performed together on many different occasions. And Simone, you are the U.S. gymnast with the most medals ever, and you have a smile that lights up the stadium where you win over and over again. But today, you have masked up, and I want to thank you for that and for joining us today to make the announcement. Oh, there she is. Simone, can you hear us?
Oh, yes, I can hear you.
Okay.
I'm so proud to be a part of this campaign, so hopefully everyone out there gets to wear their mask.
Thank you, Simone. Thank you so very, very much. And Carlos, we are missing baseball right now, but I'm thankful that you recognize the importance of masking up. Carlos Correa.
Thank you, guys. Hope everybody is following this protocol. It's important that we all follow this and practice social distancing, and obviously mask up. We want baseball back. We want everybody to go back to normal. So let's do it.
Thank you, Carlos. Look forward to playing with you again. And Slim, man, my brother, Acres Home, Fofo, for taking time today to be with us and tell us about your battle to recover from COVID-19 and why you want everyone to mask up.
Being that I ended up being one of the people who was affected by COVID-19, I recognize how serious it is. And, just advice from me when doctors don't really have no answers, the best thing you can do is just avoid the situation. So if you do have to leave the house, I would really strongly suggest that you mask up and glove up and just sanitize on a regular, man, and just stay safe and try to avoid the situation.
And I just, on behalf of everyone at Metro and the public as well, I want to thank Slim Thug so very much for donating 1,000 bottles of hand sanitizer and 300 face masks to Metro bus and rail operators and police officers. So thank you so very much.
No problem.
All right, so give it up to Simone, Carlos, Slim Thug. Thank you all so very much, and thank you all for joining this campaign. Appreciate it. Thank you all.
Thank you.
Today's focus is about the health equity response to COVID-19. It is about making sure that we don't leave out anyone, our at-risk populations, our vulnerable communities, and we know that this particular virus has had a disproportionate impact on those communities. And as the conversation is turning more and more to opening up, we need to make sure that as we move forward, that we don't leave any of these individuals behind. And to lead this effort, I've asked several of my directors to assist. They'll be working very closely with Marvin Odom, our Chief of Relief and Recovery Officer, and the directors, the head, the team leads, Shannon Buggs, Marissa Aho, Julia Stepetch, and Janice Weaver. And then I also want to acknowledge that's with me today is Councilmember Evan Shabazz, representing District D. And so today, the focus is about her. And so let this hymn step to the side, and I'm going to turn it over now to Shannon Buggs, and she'll take it from here.
Thank you so much, Mayor. The COVID-19 pandemic is a generation-defining crisis. It has disrupted all social systems, crippled the economy, and altered the way we live, work, and worship and play. Many of us are fighting back against this invisible enemy by complying with stay-at-home orders, following social distancing guidelines, and wearing face masks in public spaces. While so many are doing what we can to avoid catching the virus, we still worry it's not enough to stay safe. According to the World Health Organization, the odds of developing a severe to fatal case of COVID-19 are estimated at 20% of active infections. Those chances, however, are higher for people with asthma, diabetes, high blood pressure, heart disease, cancer, and other illnesses that weaken the immune system and exacerbate the effects of COVID-19. These are the diseases that, unfortunately, are also very prevalent in my own family. And every time I hear that list, it scares me because it is so personal for so many of us. As Mayor Turner stated in his daily briefing, all of the City of Houston's residents who have died after testing positive for a COVID-19 infection also had underlying health conditions. And of the 34 deaths that we confirmed today, none added to, thank goodness. Half were Black or African American. Yet only about a fifth of our city's population is Black or African American. Before COVID-19, these same chronic health conditions were identified as some of the factors making the life expectancy of Houstonians 24 years shorter than the life expectancy of other Houstonians, just depending on where you live in the city. And those communities where our neighbors are not expected to live much past the age of 64 are predominantly African American and Latino. Here in Houston, as in many other parts of our nation, the pandemic is magnifying the pre-existing health disparities and socioeconomic challenges facing our most vulnerable communities. Before COVID-19, we already knew that 39% of Houstonian households didn't have $400 for an emergency. Now, despite stay-home orders, only 1 out of every 5 Black workers and 1 out of every 6 Latino workers in the United States actually can work from home, compared with 30% of white workers and 37% of Asian workers, according to the Economic Policy Institute think tank. Both Blacks and Latinos are overrepresented in the lowest wage jobs considered high-contact essential services, including childcare workers, cooks, restaurant workers, pharmacy technicians, orderlies, and nursing assistants. Low-wage workers also often cannot afford to lose a day's wages because of illness and are less likely to seek medical care for themselves and their families than workers who have paid sick leave. Without more testing in the city of Houston and our surrounding counties, we can't fully understand the size, shape, and speed of this virus as it moves among us. But we can see where COVID-19 is likely to do the most damage: in the homes and communities with the fewest resources to respond to and recover from this health threat and financial disaster. As we start to plan the long and deliberate process of reopening the economy, Mayor Turner appointed the Health Equity Response Task Force to keep the focus on the most acute and critical need now: saving lives. And we all thank you, Mayor Turner, for appointing us to this extremely important work. So now I am inviting my colleague, Chief Resilience Officer Marissa Aho, who will share with you some of the task force strategies to do that.
Thank you, Director Buggs. The global COVID-19 pandemic requires resilience like no other crisis has ever demanded before. The ability of Houstonians, our neighborhoods, and our region to survive, adapt, and recover from the shock of this health crisis and the associated economic and social impacts is what being resilient is all about. In February, Mayor Turner launched Resilient Houston as the city's framework, which includes making Houston a healthier place to live, a more equitable, inclusive, and affordable city, and a metro area with a transformative economy that builds forward. The plan was not meant to sit on a shelf, but to be a guide for how we approach our challenges, from hurricanes to health emergencies. Fundamentally, we do this by taking care of our most vulnerable people and places. The Health Equity Response, HER initiative, announced today is focused on bringing more information and more supplies to our neighbors who are most at risk, vulnerable, and disproportionately affected by the COVID-19 virus. Using CDC social vulnerability data, health risk data, and specialized data, such as the percentage of households without access to a vehicle, we were able to work with our community partners to prioritize what need to be distributed where. What needs to be distributed where? Based on the data, we have identified a number of super neighborhoods with the highest need. These include 6 of the areas Mayor Turner designated as complete communities as part of his signature initiative to bring more equitable access to opportunity and quality of life amenities in under-resourced neighborhoods. As we receive additional donations of cash and supplies, we hope to expand the list of top priority neighborhoods to include more communities in need. So the Health Equity Response Initiative includes 4 things for now. The new Health Equity Response Task Force to help the mayor's office coordinate and scale this effort, a public health education and information campaign to encourage residents in the highest risk neighborhoods to take more precautions to protect themselves and others, direct community support to distribute essential supplies to Houstonians in these most impacted neighborhoods, and a Houston Health Equity Response Fund to accept donations to get these resources to Houstonians in these neighborhoods. It is now my pleasure to invite Juliet Stepech, Director of the Mayor's Office of Education, to talk with you about the public health campaign components of the HER initiative. Director Stepech.
Thank you so much. It's such a pleasure and an honor to be able to join you here today. The Mayor's Office of Education focuses on collaboration, communication, and coordination amongst the educational entities that exist in the city of Houston. Education is key to a brighter future, but lifelong learning, especially during the COVID pandemic, is democratic, urgent, and life-saving. Every single one of us must learn how to safely live in a world with COVID-19 until a vaccine is found. We are all a part of the solution. Every Houstonian needs to know how to prevent COVID-19 and what to do if they have signs and symptoms. This task force is working to accelerate and expand critical information to educate and empower all communities, but especially the elderly, Black, Latinx, and other at-risk and vulnerable populations, with the knowledge and skills needed to remain safe. Effective strategies do exist to prevent the spread of COVID-19. It includes hand washing with soap and water, social distancing, and as Patman explained, wearing a mask, and you can make one at home. There's a whole lot of valuable information available out there on the CDC website and also on the Houston Health Department website. Learning requires everyone to take responsibility for their own involvement and effort. Collectively, we have the knowledge to develop the skills and habits to prevent COVID-19. We're working with medical and public health experts to create and develop and distribute a COVID-19 curriculum that is reliable and accessible. And we're working on ways to reach out to the community, whether you have or do not have computers or internet access. So we're calling on the creativity and generosity of Houstonians to help us with this educational effort. We'll be engaging the community in different ways with educational strategies including 1, robocalls from the city's Department of Neighborhoods, 2, social media, 3, PSAs on radio and TV, 4, teletown halls using digital conferencing and telephone, 5, delivering door hangers and sharing informational flyers, 6, using billboards, posters, banners, and other print media. We need all hands on deck to create an informed and engaging message that will get out into our community. It must reach everyone's heart, mind, and soul. On our team, for instance, we have Nick Anderson, a Pulitzer Prize-winning cartoonist who works in the Mayor's Office of Government Relations. And as you can see in the social distancing poster, he's created the most amazing cartoons to help us educate ourselves in the most creative of ways. And we've worked with Texas Children's Hospital, the Houston Health Department, Baylor College of Medicine, Harris Health, the Houston Medical Forum, Mental Health America, and so many others who are helping us with accurate and reliable messaging. And now I have the honor and privilege of introducing Director Weaver, who will give you some more details on this initiative.
Thank you, Juliet, and thank you, Mayor. Thank you all for being here today. I have the privilege of serving as Director of the Mayor's Office of Community Relations. I want to thank Houstonians for their resiliency and generosity. No doubt, there are certain times, but there is absolutely no doubt about Houston's creativity and passion in times of crisis. We have been through floods, Hurricane Harvey, now there is COVID-19. While times are hard, we will get through this, as we always do, by working together as a compassionate and caring community there are known to be. Mayor Turner has issued the call for Houstonians to come together to help us in the vulnerable and underserved areas. We have accelerated communication efforts to identify these needs, and we are collecting supplies and personal protection equipment for senior citizens and other high risk of getting COVID-19. Utilizing data and working with healthcare professionals, we have identified underserved and undersourced areas of town that are most at risk for contracting COVID-19, and we are working to offer support, but we need you to join us. 100,000 masks, disposable gloves, hand sanitizers, has to be at least 60% alcohol, EPA-registered household disinfectant. These items will be largely delivered to the retirement homes, assisted living facilities, and independent housings for individuals 55 years of age and older within the complete communities, along with other donated supplies, personal care items, and cleaning products, and hot meals where needed. I'm so sorry. Yeah, clap. There you go. Thank you. Shall I bow? We have already created and partnered with World Center Kitchen, and to date, they have provided hot meals to over 3,000 seniors. This is a new program launched in Houston just 2 weeks ago under the nationwide #ChefsForAmerica initiative. City of Houston council members are now involved to identify more seniors in need with their respective districts. Join us in the effort, and you or your company will be highlighted as a Houston Strong hero. Mayor Turner and the City of Houston are extremely grateful, and thank you in advance for your care, concern, and contribution. Now I'd like to introduce Tommy Rosen, Executive Director of Houston Response, along with Pastor Steve Wells of South Main Baptist Church, who will share with you how they are supporting Mask Up campaign and working with the Health Inequity Response Task Force. Tommy and Pastor? No, thank you.
Hi, I'm Steve Wells. I'm the pastor at South Main Baptist Church. As the mayor's fond of saying, the most loving thing that you can do right now for your neighbor is to wear a mask or to make a mask. We are bringing together Christians from across the city, Baptists and Catholics and Episcopalians and Lutherans and Methodists. And our goal is to get 1,000 churches to make 1 million masks to give to the city. If it didn't sound like I named your church, yeah, you can clap for that. If it didn't sound like I named your church can get involved in this. Your family can get involved with this. You can get involved with this, and Tommy's going to tell you how.
I should have known better than to follow the preacher. Thank you. Houston Response started after Harvey, and our goal is very simple. When crisis happens, the churches step up. We've seen that. We've known that. That's part of our DNA. And so this is just another opportunity for them to step up. And so the Masks for All campaign is really just that, the opportunity for these churches to be able to develop masks, to create them, to distribute them, give money towards doing that. So all of these groups that have this need and will have this need for an ongoing period of time can ensure that the under-resourced families get these masks. And so it is our honor to be a part of this. real quickly, I do want to say that, for the churches and congregations, thank you. These are some wonderful examples of those masks that are being homemade. So if your church or your congregation or your organization or even groups from other faith groups, if you are interested in joining us in this, go to houstonresponds.org/maskforall or just houstonresponds.org. And there will be steps there to simply sign up. There are plenty of there's 2 options created by the CDC to make your own mask, whether you can sew or you can't sew. There is a non-sew option. So all the instructions that you will need to do are at that website, so to be able to make masks. And also, if you would like to be a distribution point or a pickup or a drop-off point. So it's very simple, very easy. This is something that almost every church or congregation can do across Greater Houston, and it's just another opportunity for us to step up and show love for Greater Houston. Thank you.
Hello, I'm Susan Christian. I'm Director of the Mayor's Office of Special Events. Mayor, this time last year, we were announcing our largest July 4th celebration, Freedom Over Texas. And so it's challenging as an event professional to stand up here and say, we don't have events, hadn't been going on for a long time, just through my office. There have been over 300 events that have been canceled, but the Houston special events industry is strong. We have amazing companies right here in Houston, and we know that the events will one day come back. But events are many things. We build small festivals, which are really big cities when you think about it, and all the infrastructure. And so we do a lot of logistics. We've provided logistics outside of events to support our sister departments during times of natural disasters for well over a couple of decades. And here we are today in the midst of this historic pandemic, and we will provide support where is needed, just as we're providing support for meals at our testing sites. My office will also distribute over 200,000 masks that 50,000 will be delivered this week, and 150,000 next week, Mayor. That is on top of what you've heard announced today. And it will specifically target complete communities and at-risk neighborhoods for this Mask Up program. I've worked with our Office of Emergency Management. I want to thank George Bunick and Jackie Miller for their leadership. We've worked together for many years, and so they're going to be receiving this inventory. And then my team and I will be in charge of distributing this inventory throughout our at-risk communities. Of course, we're not going to reinvent the wheel. We have so many nonprofits out there who every day go out and work with our seniors and all of our vulnerable populations. And so, man, let me tell you, we couldn't call them fast enough. So, we've identified many nonprofit organizations, their existing programs, organizations like the YWCA and our own health department, who is over so many Meals on Wheels program, like through the Interfaith Ministries program. And they have already identified all the population with those most in need. So within the next couple of weeks, we're ready to get this program going. And event person. We're ready to get this program going, and at the request of Shannon and this task force, and of course, Mayor Turner, we know that we'll be able to accomplish the distribution quite readily, thanks to these nonprofits. I also want to give special recognition to Cigna. Cigna came in, and they have already donated a significant contribution, over $50,000, Mayor, to support this program. And then also we have another $150,000 that is also coming in and hitting our nonprofit account, Houston Civic Events. So we're proud to be a part of it. We're proud to join the team. We are part of the team, and we will help stand up this program, Shannon, be it your wish and your direction as you see how we can best benefit the program. So thank you.
Thank you so much, Susan. This task force is not working without Susan Christian's team and helping us with the logistics. I think everybody in the leadership said that they were going to come and just conscript her into this effort. And before we bring back up our very favorite hymn to close out our HER Task Force news conference, I do want to make some thank yous to David Callender from Memorial Hermann for also contributing to the HER Task Force, an initiative with 250 gallons of hand sanitizer that we'll be distributing. We also have Roland von Kernatowski, the president of TXRX Labs, which is right there in Second Ward, one of our complete communities, and they have also started a cloth face mask campaign and have delivered many boxes of those cloth masks, so we thank them tremendously. And that's work being done in a complete community. Ann Whitlock is also here with us today, the executive director of Connect Community, and she has the Sewn Goods for Coronavirus Safety Collaborative, and we are also grateful, and that's someone who's working in Gulfton, another complete community. So just because the work is being done to help the most at-risk neighborhoods, it doesn't mean that those at-risk neighborhoods are not doing a lot of work to help others too. And so we see that this is a cyclical opportunity for all of us in Houston to come together and help each other. That's why you've been seeing that hashtag Houston Together. Even though we're apart, we are still connected as a city and doing the work to keep all of ourselves safe and alive. So now we're going to invite the mayor. Oh, and I'm so sorry. We keep doing this, and we are so happy to keep doing this. Farouk Shami is here with Farouk Systems, and he has again donated to the city of Houston in order to bring not only hand sanitizers for all the people in the at-risk communities, but he's also providing to the city of Houston 7,500 N95 masks for our medical first responders, and that frees up our ability to get more of the masks out to the most at-risk neighborhoods. We're very appreciative of that.
All right, and Farouk has already provided us with 15,000 bottles of sanitizer.
1 million.
1 million. Well, the value was at $1 million. I remember that.
We got to K95.
Right. But he's providing some additional items. Farouk, why don't you come and just say.
Okay. Thank you, Mayor. We are Houstonian. We are one. We love each other. And today is Ramadan for Muslims. And it's Ramadan for Muslim is contributing to the poor. So what we really need to do, we have 4 drums that will be set in 4 different stations in the poor area of African Americans and Latinos. We will be filling sanitizer free, and we'll be bring your bottle. Okay, the mayor will assign the location, and we will bring shampoo and conditioner as well. Okay, we are providing sanitizer with local aloe vera that's grown in Houston actually, and there is no crack in hands. Soft hands, glycerine. This is so important for the first responders and for everybody. So we are one, we are Houston, and you are our leader, and I appreciate what you're doing to save lives. Thank you, Houston. Thank God for being here.
And the last thing is, the mayor has not, at this point, talked about the actual task force. So that is our last thing here.
And so again, I want to thank everyone who is contributing to the Masked Up. Farouk, let me thank you. In addition to the sanitizer, I know you.
More sanitizer.
Is that the sanitizer?
Yeah.
Thank you. Thank you, Farouk. He's providing 4 big drums of sanitizer that will be in 4 different stations in our low-income areas. Farouk, thank you, Farouk. Thank you. And so he's providing the sanitizer, but you also said something about like the hair conditioner. And right now, my head probably needs the conditioner more than the sanitizer because I keep trying to brush it down and it keeps wanting to pop up. So
Since you started using chi, look, it's growing.
thank you, Farouk. You can step down. Okay, I want to thank everyone who is contributing to the Mask Up campaign with donations, including Simone Biles again, Carlos Correa, and Slim Thug. I can't thank these individuals. They are just proud Houstonians, and they continue to give over and over again. I also want to thank the Houstonians who have stepped up to be a part of the Health Equity Response Task Force, we refer to now as HER, and the logos of their organizations are on the screen behind me. I want to thank all of these team members, team leads. Yes, please give it up to them. And we also have with us today her task force members, Dr. Kathy Flanagan. Dr. Kathy Flanagan, if you'll just come this way, Dr. Kathy Flanagan is going to be leading the efforts of bringing in minority doctors because a lot of these matters, not just physically connected, but also very mental as well as emotional. And Dr. Anjali Sharif, Reverend Steve Wells, and Dr. Al Kashim Shah. Because these doctors are going to be stepping in and offering their assistance, Dr. Kathy Flanagan, if you can just kind of give a brief description about what you all are going to be doing.
Thank you, Mayor. Yes, what we hope to do with the Houston Medical Forum is to go out into the communities and educate the communities. In particular the African American communities. We do believe that when you put people who look like them in front of them, they're more likely to comply. And so that's what we're hoping as we work along with everyone else on the team to make sure that they know to socially distance themselves, okay, wash their hands, okay, and to do all the things that we have been recommending.
Thank you. And we also want to acknowledge and thank the CEO of Memorial Hermann as well for their contributions. The Houston Seafood Company, Cigna, Clear Channel Outdoors, want to thank all of them. These are the subject matter experts in medicine, public health, marketing, faith, and a host of other fields that will work with city staffers to not only help to solve the immediate needs, but also help us rebuild our social systems to be more equitable. And this is the task force that will be working directly with Marvin Odom as he leads the effort on recovering for our city. The point that we simply want to make and leave with you today is that we are committed not leaving anyone behind. And the city of Houston is the most diverse city in the country. And in order to make sure that we touch the needs, it is important that this team be as diverse as possible. And we are committed to doing just that. And so as we began this conversation about reopening, we want to make sure that we are touching and working very closely with all of our communities, especially those who are at risk and most vulnerable.